Leading with safety, encouraging courageous conversations in healthcare. This is my personal leadership challenge. In healthcare, safe patient outcomes is at the centre of all that we do. How do we ensure that this is happening? One personal challenge as a healthcare leader I would like to explore is, how do I create a space where people feel comfortable speaking up about safety? Why is this an important challenge? To explain why it's important, it's crucial to understand what is speaking up for safety, what is the impact on a healthcare setting, and why is it a challenge for leaders? What is speaking up for safety? A healthcare literature systematic review in 2023 defines speaking up for safety as a healthcare professional identifying a concern that might impact patient safety and voicing this concern to someone with the power to address it. Why is it? What is the impact on healthcare? Speaking up for safety literature reports significant benefits. These include things like improved patient safety outcomes, improved employee well-being, and improved cost effectiveness. Improved patient safety. This is better patient care. When workers speak up on potential hazards, they can be addressed before they cause harm. This includes things like medication errors, equipment concerns, or misunderstandings in clinical situations. Reporting near misses and errors ensures that corrective actions can be taken to reduce the chance of them happening again. Improved employee well-being. If staff feel safe to speak up, it promotes a healthier work environment and it reduces stress and burnout. This improves retention and overall staff satisfaction, which in itself leads to a safer working environment and improved cost reduction. A safer environment with less clinical incidents and more stable workforce is a more efficient and a more cost-effective environment. So why is this a leadership challenge? If it's better for patients, it's better for staff, and it's better for the health system, then why is this a challenge for leaders? Sounds like an easy sell for a team. There are significant barriers within the healthcare environment to speaking up. An evaluation in the Harvard Business Review emphasizes that speaking up is a highly vulnerable behavior. It is risky. People don't speak up as they fear retribution or repercussions, especially if the situation is unclear. Studies demonstrate that there are many multiple factors that make speaking up less likely. These include personal and workplace factors, such as gender, profession, the types of shifts that employees work, the length of their employment, the presence of a hierarchical structure, and the employee's position within that hierarchy, or the presence, or the perception of a presence, of a power differential. So, considering it's so important to patient safety that we speak up, and that there are so many barriers to create an environment that's speaking up, what are the evidence-based mechanisms to support an environment that promotes speaking up? In reviewing the literature, I found that there are several well-supported mechanisms to support an environment that encourages speaking up for safety. I've broken these down into short-term, medium-term, and long-term goals for me as a leader. The short-term goals will include leading by example. A leader must model safe behaviours and be vocal about promoting these safety behaviours in others. And we must provide training. We must provide education to all of our staff about what is speaking up for safety, why it's important, and to teach our staff the skills people need to be able to speak up. In the medium term, I need to develop an environment that feels psychologically safe to speak up. And the way that we do this is through consistent encouragement of open communication, providing clear channels for reporting safety concerns, and publicly recognise these concerns and demonstrate a commitment to actively improving them. In the long term, we need to continue with this commitment to continuous improvement. And studies have demonstrated that environments that are high in psychological safety and in joint problem-solving skills demonstrate higher quality decision-making and quicker error detection, which also leads to this improved safety environment. So, my leadership challenge is to use these strategies over the short, medium, and long term to improve the psychological safety and create an environment where my staff feel safe. to speak up for safety.